Welcome back, everyone. This is the final part of our little bite-sized lecture series on the epidemiology of pandemics and lessons for COVID-19. Again, my name is Kyle Fries. I am the epidemiologist for STC Health in Phoenix. And I wanted to start by just saying that these data are changing really rapidly. So these are as of the 24th of March. And I also wanted to introduce the caveat at this point that everything I'm presenting here is a really brief summary of everything that I can determine is important at this point. There are many other resources out there from a lot of smart people. So I really encourage you to make the time to search those out and question things for yourself. But I think this is meant to be just more of an introduction and kind of an overview for those that haven't been really digging into the information themselves. So I hope this has been useful. Please reach out to me with any specific questions. I'm happy to provide additional resources, refer you to specific specialties, even it being clinicians and things of that nature. So let's get started with the final part. In this part, I wanted to focus on digging into a little bit about who is getting the sickest and how these data differ between different countries as we learn more. Again, this is just supposed to be an overview, but I still think that there's some similar themes that are reverberating throughout the literature that are worth mentioning. This slide is meant to kind of dovetail into our previous part where we were talking about case fatality rates between different pandemics. This looks at just the differences between COVID-19 and seasonal flu. So if you can just focus on the two bars that I've highlighted in red there and ignore the right side of each graph really quickly, this is just harking back to how we talked about that COVID-19 has a much higher overall case fatality rate compared to the seasonal flu. If you're combining all ages. However, the relationship changes a little bit, and we learn a little more if we start stratifying by age group. So if you look down the x-axis there, things are broken up by kind of 4 different categories, ranging from the youngest to the oldest. And as you've heard in the media, it appears that the highest case fatality rates are associated with those in the older age groups. I do want to point out that obviously these age categories are not completely lined up, so it's just for illustrative purposes. What I wanted to take away from this, obviously, that we think that older age groups are at the highest risk of death from COVID-19. However, I don't want to present either a false sense of security here either in the younger age groups, though yes, there is only a 0.1% case fatality rate for those, for example, 0 to 19 years of age compared with seasonal flu, but it still is significantly larger than that from seasonal flu. So while the absolute risk is lower compared with seasonal flu, COVID-19 is still very, very serious for all age groups. This slide presents, I guess it's now a little outdated data, but these are from the World Health Organization and one of the earliest investigations from China. This is just reiterating that patients of the oldest ages have the highest case fatality rates. So looking at the left side there, moving from bottom to top, we have our youngest age groups all the way up to those of oldest. And we see that the case fatality rate is by far highest in the oldest patients. And once you get above 40, there's really this sort of exponential increase in the case fatality rate. There's another layer to this that I wanted to mention is of pre-existing conditions. As you've also heard, those with pre-existing health conditions are at higher risk of dying from this disease. Here we're just showing that those with cardiovascular disease, chronic respiratory disease, and a few others there have been associated with higher case fatality rates. However, just recently, a few days ago, the CDC came out with some new data from the US. These are from the Morbidity and Mortality Weekly Report from March 18th. Without going into the limitations of the study or anything, I think this is worthwhile reading for yourself. I'll post a link, or I can make that available if you reach out to me directly. But what this is showing is that the US data overall are pretty similar to those in China, with the exception that hospitalizations occur even among younger patients. Now, I can't speak to what is driving this relationship, whether it's just differences in population, differences in healthcare system. There could be a number of factors, or whether it is truly the disease is manifesting itself differently in these younger groups in the US compared with China. But I also wanted to point out that, again, we see that deaths are most associated among the older age groups here. But just to orient you a little bit, kind of backing up for a second, the light blue bar is for the hospitalizations in the study sample they looked at. The kind of medium blue bar is for ICU admissions, and the darkest blue is for deaths. So you can see that the data are slightly different, again, than China. But again, there's an overall pattern of the most severe outcomes, meaning death and ICU admissions, do increase alongside age for the most part. There were a lot of missing data in this study. Again, I don't want to get into it too far, but I think this is a good kind of first data out of the US that is worthwhile taking a look at. Another main point that I wanted to make with this lecture is that all of these measures I've been mentioning, case fatality rate, attack rate, they're not stagnant measures. So this is showing data from China from the 1st of January through kind of mid-February, third week of February. The differences in case fatality rate by both time and the location. So to orient you to this figure, the blue bar is data from Wuhan. The orange bar is from the Hubei province outside of Wuhan. Gray bar is for China outside of that province, and then the yellow bar is for China overall. So again, typically case fatality rates decrease over time for a number of reasons. We learn more about the disease, our healthcare response gets better, so on and so forth. But the takeaway from here is that case fatality rates are not consistent in time or place. So these numbers might look different throughout the United States. Kind of a summary slide here. I wanted to address what you can do. The main thing is with this first bullet point is to please continue to pay attention to your local health departments. They have the most recent, the most trustworthy data. They're going to give you the best recommendations out there. Pretty consistently, at least recently, our recommendations are that to maintain social distancing, and I can't iterate enough how important it is to stay at home as much as you can, other than for life essential errands. This is really what's going to be able to help us accomplish what this figure is showing below, what you've heard ad nauseum over the past weeks, is that we want to flatten the curve so we don't overwhelm our healthcare system. Ways we can do that that are within our control, we have the responsibility to do. So on top of the social distancing, we need to wash our hands frequently. When it's available, participating in the vaccination outreach, but this goes beyond just the vaccination for COVID-19. Please stay up to date on your most current vaccinations as well, because if you are current on flu and pneumonia for certain age groups, you have a less chance of ending up in the hospital for those things, which obviously further exacerbates this spike in the curve. And if we can focus all of our attention on treating COVID-19 patients, it's really kind of a community effort. As far as education, I think it's important to reduce stigma. I've read troubling reports in the media about Asian Americans being targeted for reasons that are beyond me, but we need to make sure that we understand that this is a disease that affects peoples of all walks of life, all races, creeds, everything. So please work to reduce stigma and take care of each other. And again, going along with that is mitigating the spread of misinformation. Please get your information from people like me or your health department, people that know how to review the literature and know how to present that literature. And then finally, we need to be aware that, as I showed in previous lectures, that this virus will likely persist both in time and location. How epidemic curves work, as I showed you before, there are usually multiple waves. So we need to be prepared for that and not to let our guard down. So all of these lessons I've taught throughout these lectures need to be applied for the immediate and long-term future to ensure the health of everybody in our community. So with that, I'm going to wrap up. I wanted to thank you for your attention, and please reach out to me either separately or through STC. I'm happy to answer any questions, or if you'd like me to expand on any of this, I can work with you to educate your staff or even answer personal questions. I'm happy to do that. And if I don't know the answer, I will refer to you to somebody who knows the answer. I will work to find it for you. Thank you again for your attention. I really appreciate it. Make sure, stay safe, stay healthy, take care of each other, and be kind to one another. Thank you very much.